Good morning, everybody. I'm Paul Ayoub. I'm a member of the Executive Committee of Nutter and co-chair of the COVID-19 Task Force. And I want to welcome you to this morning's program, which is a continuing series of webinars on moving forward to the new normal. It's a part of our offering of thought leadership and actionable advice on issues relating to COVID-19 and its impact on our region. Today's program is focused on navigating transportation in a COVID-19 world, and we're pleased you can join us for this discussion. I'm going to introduce our panelists in a moment, but first I just want to give some introductory remarks. We all recognize that transportation is a critical driver of our ability to move the economy and our lives forward. And with the easing of COVID-19 restrictions, in our region, in our nation, and in fact across the world, all eyes are on how mass transit and alternate transit systems can operate effectively and still ensure our collective health and safety. So this morning we'll examine how the economy gets moving again with transportation experts from around the world, literally around the world. Our goal is to learn from best practices from other countries and other parts of this country to evaluate the best way forward for our region. So before we begin, two notes. First, I want to thank the whole team at Nutter for all they've done to put this program together, especially many you won't see: Stephanie Goldstein and Jay Wager, Alex Kelly and Heather Merton and Eva Skalkos and Colleen Bidgood. But I also, more importantly, on a larger note, want to acknowledge that we do not discuss this issue in a vacuum. In addition to the challenges of COVID-19, the realities of racial inequities in our country are in deservedly sharp focus. And we have seen through COVID-19 that a disproportionate number of people of color have been impacted by this virus. And likewise, equity in the transit options, especially as we reopen our economy, need to be front and center and a priority for evaluating how we do so, and in a context that will bring equity to all, and that will be a context of our conversation this morning. So with that, we have 5 terrific panelists. I will introduce each one of them in depth as we call on them, but as you see on your screen, we have Dr. Maya Ben-Dror from the World Economic Forum, and Katie Lapp from Harvard University, Ying Lee, Jim O'Leary from ACI, and Sathish Rajendren from as well. So let's begin our program. We can, and we're going to start with you, Ying Lee. Do we have Ying Lee is a managing director of security business for Certis Security in Australia, and do we see him on the screen? We do, yes. So he oversees security for key transportation hubs in that country, including several airports and the urban suburban Sydney train system. Ying formerly oversaw security for the Singapore mass transit system and was head of ops planning for the Maritime Security Task Force when he was serving as a high-ranking officer in the Singapore Navy. And that was at a time when the SARS pandemic was in that region in 2002 and 2003. So it gives us really an overview of an international experience and a pandemic experience. So Ying, welcome. And why don't you share with us how the transportation systems in the APEC region have changed due to the health risks posed by COVID-19, and also talk to us a little bit about your experience in Singapore during the SARS outbreak, if you could.
Thank you, Paul. Glad to be here, and thank you for letting me join the webinar. I'm sorry for my poor internet connection from down south in Australia. I think we had learned quite a few lessons from SARS and now COVID-19. I think we have learned definitely a lot about how do we define new norms as they evolve and how we communicate that clearly to the commuters on all our transport network. And for example, how we start to set up contact tracing, temperature screening. These are very confusing new measures as we start introducing them at airports, transport hubs, bus stops, and so on and so forth. When we also start defining social distancing, there were a few parameters and variables around what defines social distancing, and that can be causing tension to commuters, especially if they travel in family units. And all this forms part and parcel of how the society start to move with the times and grow with as the needs evolve in terms of the transportation requirements. However, there were definitely some issues around how we deal with the concept of asymptomatic spread of the disease, and we will then need to start putting in new operational measures on how do we detect. One of them was temperature screening, for example. Paul, should I continue?
Yes, please do. Yes.
Yeah. All right.
Go ahead.
Yeah. Thanks. Yeah. I think when we start putting in all these new operational measures around dealing with more and more, as more information of the COVID-19 comes out from the medical part of it, we started to put in very clear definition of what defines a fever. What happens when you have 37.6? What happens when you have 37.9? There were a lot of debate around what are the thresholds, what are operationally practical, how do you measure, how do you then respond? And because transportation is so vital to our livelihood, every little bit of measure being unclear causes a lot of ripples in the way we move in our transportation network. And that is why I think as we start to ease back the restrictions, we need to be clear when we communicate, so we create a lot of confidence that we can use transportation network without the fear of increased risk of infection. When now, especially with a lot of cities facing this phenomenon called the second wave. And finally, I'll just add that because of the risk and the fear, there are a lot of preference to self-drive. And in busy cities like Sydney, and I presume Boston will be very similar, we run out of parking lots because a lot of people are driving to work, picking up their kids, and those with two cars, and partners, all are driving their own car to do the multiple errands they have to do. So that creates a different phenomenon in how the transportation network is now stressed and causes a lot of unbalanced loads during the peak hours. Thank you, Paul.
That's great. Quick question well, let's do this. Let's go to Sathish, and then we'll come back to Ying with some questions. But Sathish is the Chief Operating Officer of Facilities and Asset Services for Knight Frank in India. And he's also part of the Occupier Services APAC board, working closely with Knight Frank's global and APAC teams, providing strategic and operational leadership. Significantly, Sathish is also a global board of director for CoreNet Global and co-chair of CoreNet Global India. He oversees the management of the Central Railway Station in Bangalore in India and has extensive management experience with airports and railways and public and private and corporate transit systems internationally. So Sathish, welcome. And building off of Ying Loong's comments, tell us, your experience in India and what you have learned, lessons learned, and some of the guiding principles that we may take from India here in the United States.
Thank you, Paul. Just before I get into that question, I very much agree on what Ying had spoken about, the various impact of COVID, especially from the transportation. But however, having said that, let me just give my general view about the transportation. I think there's some background noise. Is it mine or somebody else? Okay. Yeah. So transportation, as you all know, it's a critical driver for our ability to move the entire economy and our lives forward in order to provide services of the modern, globalized, and interconnected world. Since the beginning of 2020, more and more countries across the globe have shut down their borders and limited the transportation to contain their coronavirus outbreak, which is creating challenges for international travelers, and also the transportations locally in all the countries has become a challenge. As a consequence of the coronavirus outbreak, certainly the transportation industry is hampered and brought uncertainty across air, rail, road, and all these sectors. Therefore, there are various interpretations of its potential consequences on the transportation industry. I just want to take a reference, a quote. I came across a 2020 survey that reflects 57% of people surveyed in the US revealed that they would less likely take a subway or public transportation after coronavirus weren't to affect their community. In that same survey, 54% of the respondents in the US stated that they would less likely use ride-hailing services like Uber, Lyft, or taxi if COVID-19 were to spread in their community. Whereas in India announced the world's biggest nationwide lockdown, affecting the lives of 1.3 billion people on 23rd March. Initially set until 15th April, the quarantine has been extended to 3rd May and further went on till early June as a preemptive measure to contain the infection. In transport, Indian Railways today is the largest rail network in Asia and the world's second largest network operated under a single management and has 150,000 kilometers of track length. This rail transportation alone impacts the stop of about 12,600 trains that carries 23 million passengers daily. That is equivalent to moving the entire population of Australia, connecting more than 7,000 stations. When it comes to airways, around 6,300 flights per day carries around 950,000 people. Rest, the public bus sector, which operates 170,000 buses carrying roughly about 70 million people per day, including 12 major Indian ports. So that all has been discouraged the inter and intra-city mobility of people. In all these transportation segments, Paul, to mitigate the impact further and to revive the services, the preparedness with respect to screening, detection, and containment protocols for people and goods have been established. Overall, the travel frequency has come down by 70% in India and remaining only for catering the essential services. So I felt that this is something which I have to share. Uh, maybe you won't ask any questions on this, or I'll share my experience on the overall transportation industry response, India versus the other nations. That's a question what you wanted to
Yeah, no,
respond.
go ahead, Sathish. Why don't you do that and then we'll go forward.
Okay, let me go. So in India, Paul, the biggest challenge is its magnitude and diversified section of people using public transportation facilities. Despite the challenge, I feel Indian government has taken a very bold step to suspend total services from the day one of lockdown, except for emergency services. That's when the both public and private operators in the industry have responded in support of government measures to collectively mitigate the risk of COVID infection, realizing the intensity of risk. Aiming to gain public trust and to reassure the passengers, transport operators have taken advantage of the forced halt in operations to improve their standards and the preparedness of the safe return of operations. So in a nutshell, the transportation system in India is quick in bringing all necessary protocols and implementation basis the proactive measure and detailed guidelines provided by government, and the same has been followed by transport operators, which in turn evolved into a meticulous SOP, standard operating procedures, followed by training to their staff across to ensure respective places are safe to use for commuters. When it comes to my experience and where I've traveled to countries like Singapore, London, Australia, and even US, though the impact of virus is very high when it compared to India, but they have an advantage of developed infrastructure, advanced technology that has less pressure with respect to size of the end users. So on the outset, barring the different challenges with respect to the magnitude and diversity of end users, all these country transportations industry is taken very cautious measures in terms of social distancing, hygiene, screening practices, and adopting the method of clustered fleet management in each segment of road, rail, and airport systems. Over to you, Paul. Paul?
Oh, I think you're muted.
Hi, and thanks very much, Sathish. And I think as our panelists, if you're on our panel and not speaking, if you could mute your mic, I think we are hearing some background noise, but.
Yeah, I thought so, yes.
So thank you, Sathish, and thank you for those reflections. So Katie, thank you for joining us. Katie Lapp, since 2009, has served as the Executive Vice President of Harvard University, where she's responsible for all of the financial, administrative, and operational aspects of the university, and is a member of the president's senior management team. She's held many prominent positions before coming to Harvard, including being the EVP for business operations for the University of California. But the experience that's perhaps most notable for this morning is that Katie served as executive director and chief executive officer for the New York Metropolitan Transit Authority, which, as some of you may know, is the largest transit network in North America. And I've had the pleasure of knowing Katie as a member of the executive committee of the Greater Boston Chamber of Commerce, and she co-chairs, along with my partner, Mike Scott, the Transportation and Infrastructure Council of the Chamber. So Katie, thank you for being here. I know this, in addition to all the transit issues that you're dealing with at Harvard, there are many issues, as we've seen in the headlines in the last few days. So thanks for taking the time. Let me ask you to build on the comments of Ying, Loong, and Sathish and bring in your experience as with the MTA and what you experienced there and the lessons learned there for our region as we open up the economy and mass transit in particular. Thanks, Katie.
Sure. And thank you, Paul. Thank you for inviting me this morning, and also to my fellow panelists. This is really a pleasure and an honor. So I thought I'd just reflect a little bit. I took over the MTA in New York literally 2 to 3 months after 9/11. And obviously the focus that we had was the safety of the system, or use a term, making sure we could harden the system against attack. And that took a lot of focus, but the other focus we had was on having the users of our system come back and to feel that they were safe in doing so. And so the system obviously includes subways, buses, commuter rail, bridges, and tunnels. So what we actually had a whole focus on engaging the writers in terms of being part of the solution in terms of making the system safe. The first thing we did was, and I think Sathish, you referred to this, visible images of safety and security. In this case, it was security personnel, police officers, security people, token booth clerks, people that were there, so you felt comfortable going down into the system in case in the situation of the subway. In the COVID world, what that will be is visible cleaning, sanitizing the system. But as you go into the system, to be able to see people actually doing that, it does give a sense of security. The second part was, as I said, empowering our writers to be part of, quote unquote, the solution. Post 9/11, people were afraid of bombs or all sorts of unfortunate events. So what we actually did was took a lesson from Israel as well as Northern Ireland, where they had instances where buses unfortunately were blown up, subways were oftentimes blown up. And we actually talked to them. And one of the things they said was, give your writers, make them part of the security strategy. So out of that was born the See Something, Say Something campaign. It was started in New York post 9/11, and it then spread obviously worldwide. And that was a way in which to get our writers, they were the eyes and ears, and having them be part of the solution. In this case, I think it's in the COVID situation, I think it's reminding them that you can make yourself safe by wearing masks, social distancing, issues like that, to make sure that they felt that they too had some agency in the situation. And I think the new norms, as Ying mentioned, making sure that people understand that they need to behave differently as they engage the system, giving space to their writers, not eating food on the system, things like that. It took roughly about 5 years, as I recall, for our ridership to come back to pre-9/11 days. Part of that was obviously the economy, and part of that was the fear that writers had. But I think it's really those two lessons I saw as being applicable in this situation. And Paul, you asked me to just quickly touch upon how business leaders can be part of the strategy. And I think it's really important. And when I ran the MTA, one of the things I spent a lot of time was getting to know business leaders in New York. Business depends on an efficient and safe transit system. That's how the workers get to work, and that's how they go home at night. So having them be part, have them interact with us, and as the chamber, which you have so ably led, Paul, for many years, has really been critical in bringing together the policymakers, the governor, the mayor, the head of the T, Secretary of Transportation, with business leaders to help them communicate with their workers, help be part of the solution, whether it's staggered work hours, whether it's different shifts. And then to get to the issue of equity that you touched upon, Paul, when you open, it's really important to look at all your workers. Many office workers can drive. They have the option to drive. They have the option of remote work. They have a lot of options. Whereas other people depend on the T and depend on an efficient system. And really focusing on those workers is something that business leaders can really do, whether it's subsidized T passes or looking at the hours, providing personal protective equipment, masks, things like that for those workers. I think are really critical as we bring back the transit system.
Yeah, thanks, Kate. We'll come back and go a little deeper on some of those issues, especially as we compare New York then and Boston now. And the 9/11 analogy, I think, is an important one because, as you point out, as everyone has pointed out, having confidence and feeling safe is going to be the #1 issue in terms of opening the economy and making transit really accessible. So thank you very much. So Jim, our next panelist, Jim O'Leary. Jim is over 40 years of experience of executive public transit management experience of passenger systems throughout the US and the Caribbean. Over 30 years ago, he co-founded and is still president of Alternative Concepts, Inc., which is a national transportation firm that operates and manages multimodal public and private transportation services in our country. It's currently one of the largest privately owned providers of bus and rail transportation systems and has operations in Massachusetts and Arizona and Colorado and Connecticut and Puerto Rico. And also ACI is part of a consortium selected as the early train operator for the California high-speed rail system scheduled to open in 2025. So I first met Jim when I was assistant press secretary to the governor, and Jim was in the executive office of transportation, and then subsequently became the general manager of the MBTA for almost a decade, which for those of you in Massachusetts know that serving in that role for 8 years, the record that few may want to be. We appreciate your service. So Jim, hearing what you've heard already, maybe you can talk about your experience and what it means for our region as well. So thanks for being with us.
Paul, thank you very much. That's very kind introduction. I just want everybody to know I started very young in transportation. But, again, in the US, unlike our colleagues from Asia, we have 50 different approaches to the virus. So our operations in Denver and Phoenix are very different than the operations we have in Boston. Boston, because of the early spike, responded very strongly and aggressively to the use of PPE and masking and social distancing as well. Places like Denver and Phoenix, frankly, did not respond as forcefully, and there's now seeing a spike. But it's been a real challenge in terms of providing transportation. I think, as Katie said, one of the things that Boston has done very well, I think, MBTA, is focusing on the transit-dependent community and making sure that there is some level of service. So unlike India, where there was a complete shutdown of service, Boston has tried to basically balance that with the utilization of bus operations and rail operations to service the transit-dependent. We operate a lot of shuttle bus services, for example, in the hospital area. Obviously, we added bus service into the hospital area in order to accommodate hospital workers, and did that very effectively. And again, in cooperation with the hospitals, we spaced, our trips so that to minimize the number of passengers per bus. So those are the kind of strategies that are going to have to go forward. And I think it's going to take a while before there's people return to transit. I think a vaccine is going to be critical in terms of people having confidence. But again, I do think that the transit authorities in the U.S. have responded very aggressively in terms of sanitization, the use of PPEs, and informing the public of what they're doing and how they're trying to basically secure the system. I think the challenge even before the virus was how to accommodate and working with Uber and with Lyft, working with private carriers. I suggest to transit operators that utilization of private carriers like myself and Uber and Lyft is going to become a very important part of the response going forward. I think that again, strategies, and again, there's going to be a sense, particularly because of financial issues, to contract some places. I think that'd be a mistake. I think, again, you need to basically provide the social distancing, which means adding more services in some cases. But as, again, the MBTA is focusing on those transit-dependent communities to be sure that there is adequate service to those communities. I think, for example, things like fares. Fares have grown pretty aggressively in Boston in the last few years. I think the government ought to be thinking about reducing fares, trying to encourage people to use transit again where appropriate, and again, working with the private sector and private companies, particularly to maximize the use of buses and shuttle services and private car services as well. Paul, the other issue, again, that we deal with, and we mentioned, we run the transit system in San Juan, Puerto Rico. The other governor has shut down the rail system and has been shut down since early March. And frankly, again, there's been a spike with the increased testing in Puerto Rico. And again, the lack of resources, the lack of available resources in Puerto Rico have led the governor to continue that shutdown. And it's probably going to be mid to late July before we open up transit services in San Juan, Puerto Rico.
So I'm just curious. So what are people doing as they come back in Puerto Rico, or are they not back?
To the extent they're back, they're driving their automobiles. You're seeing traffic increase, congestion increase, and in many cases, people are working from home. And in many cases, a lot of the retail shops and a lot of the businesses are still closed. So the unemployment has spiked substantially in places like Puerto Rico.
Yeah, thank you. So I want to go to Maya, but we're going to come back to the issue of the interplay between traffic and congestion in transit, because in our region, we already knew that there was over congestion on our road infrastructure, and the transit system, despite what I would say is huge efforts by the governor and the general manager of the MBTA, still didn't have the confidence of the public. So that's going to be a real tension as we go forward. So we'll revisit that.
Agreed.
So Maya, let me turn to you and then we'll come back to that. And I think you're the perfect person to now sort of be our cleanup panelist. So Dr. Maya Dror has a career as a thought leader on mobility and sustainability around the world. So currently is at the World Economic Forum based in San Francisco, where she leads the urban mobility, where she is the urban mobility lead, and previously was the lead for automotive and autonomous mobility for the Future Mobility Platform. At the same time, serves as the curator for the Global New Mobility Coalition, which is over 100 globally renowned experts, NGOs, and companies focused on the shift to the shared electronic and autonomous mobility system, often known as the SEAM system, and has been co-founder of Best EV, that provides automakers and the public with insights on the performance of virtually every model of electronic vehicles in China. In addition to all of that, of course, she has held a number of other positions relating to innovation and mobility and sustainability, both in China and Israel. And Maya, before you speak, I just want to thank our mutual friend, Debbie Pell, who was on law review with me in law school, who and is with us today, but introduced us. So I'm glad to have met you through Debbie and glad you could be with us. And just want to hear your thoughts. You've heard about the systems around the world. I know this is what you do every day, is thinking about the future. So give us your perspective of where we are and where we might be going, and what the benefit you can give us for our region. Thanks.
Thank you, Paul. And thank you everyone for joining me, my fellow panelists, and also the audience here that I cannot see, but I hope you are listening in and enjoying this conversation. I'm dialing in from San Francisco, and I hope that on my side, the sound will work well.
Hey, Maya, can you get closer to your mic? It's just a little garbled, so I'm not sure if you can be closer to your microphone or not.
Is it better now?
Much better, much better.
Good. So, I'm seeing faces. Am I still blurry?
Let's try that. Maybe try an earpiece. Because I make sure I know what you're going to be telling us. I want to make sure people can hear. It's very important for us here.
Is it better now?
So much better. Thank you, Maya.
Great. Surprisingly.
Perfect.
Yes, as everybody noted, the pandemic was really is a stress test specifically for our mobility systems, and has underlined a lot of gaps in our system. And I'd like to offer, and I'm sort of bundling some of my fellow speakers' points here into two perspectives that relate to how we recover from the pandemic. And then maybe highlight one umbrella approach that I've been advocating for and working on. So the first point is, we pour billions of recovery funds, and we need to ensure that as we do so, we're not just addressing our short-term recovery plans. And some of you have noted that a lot of people have lost their jobs, obviously those working on mobility systems, either be it a public sector or private sector. As we've seen a decrease in demand and decrease in operations, and the need for mobility or transit operators to survive, and these great innovative companies to handle the crisis where demand has gone down to zero. But while we work to ensure that some of these livelihoods are saved, we also need to have our, not lose sight of the role of a resilient mobility ecosystem and the role that it plays in equity. And I'm so glad to see that so many of us sort of have noted and acknowledged that, mobility equals the ability not just to get to jobs, but to get to financial centers and to get to recreation and to get to all of these needs that are essential for us to make livelihood and for people to have socioeconomic mobility. And it's funny enough, there was just a video about the gaps between socioeconomic mobility in different countries, and the role that transportation plays in that. And often cases, even though those that are depending on mobility systems really lack choice, they also like now the ability to protect themselves. So limiting to the point that Katie made on biosafety, how do you make sure that people that cannot afford to use any other means by means of high occupancy can maintain their safety while still keeping their jobs? And how are we making sure that we embark out of this crisis? We not only serve those that have been directly impacted by loss of jobs, but also those that want to recover and go back to jobs later on that are not in mobility systems are able to find these jobs. And we know that we're not doing a good job until now. And now we have an opportunity when we channel these funds to have this long-term insight. And this is one of the reasons, by the way, that the forum has created a We'll Move, which is a digital platform to connect between those that provide mobility demand, no matter where are in the world, and they're able to provide digital systems that can connect between different modes and provide different routes, so that those that require mobility options, be it first responders or be people that need to get back on their feet, are able to find services where services are gone or where services are not flexible enough. So that would be my first point. And my second point, to sum up some of the things that you've said, and I think can be amplified a bit further, is that the crisis is also signaling a cumulative sort of gradually or increasingly the need for us to address another crisis in the horizon, which is a climate crisis, and our need to ensure that our mobility systems are sustainable. And we see regional governments requiring or holding on to emission performance when they provide recovery funds. Not everyone is doing that. And we see some nations, we see countries waking up and saying, well, actually, we're going to not eliminate subsidy for EVs because we see the need now to continue with the subsidy for 3 more years until 2022. And that is crucial. And this is not just because transportation plays a huge role in global warming, a quarter of global emissions originate in transportation, but also it has a direct impact on our health. And as cities grow, the exposure of people to bad air quality that results from vehicles can go up to 70%. And even in cities in the West, I mean, even I hear from friends in Europe, from friends in Tel Aviv, and from friends from other places, that they actually have been in lockdown on their porches, those that are lucky enough to be in skyscrapers, and they discovered that they have wonderful view. They can see it all the way to the ocean. And this is an indication of how severe the problem is without us even noticing, going by our day-to-day. And not to speak about the costs that it entails on our systems. About 3.5% of the GDP on average is expensed to recover money that is lost for these health costs of emissions coming from our transportation systems. And passenger mobility specifically, and the emissions from passenger mobility specifically, is increasing by 2.5% annually. We're not even on track to decarbonizing our mobility system, not even on track, even if we hold on to regulations that we've had before the crisis. So maybe to wrap it up and then go to the approach that I'm proposing. There is an opportunity here. We have all the technologies we need, and we've seen it with the pandemic. We've seen how a resilient, flexible system looks like, where you can pick up, to James' point, you can pick up your phone if you have one, or have access if you're stepping out of a hospital as servicing your community. You can, instead of going into a half-empty bus, you can go on an Uber ride in Florida. I mean, we've seen these opportunities where you can take a scooter instead of your regular commute, and this works well. And we've seen cities voting for that. We've seen cities expanding their bikes all over, from New Zealand to Milan to New York and Philadelphia, where we've seen 150% increase in demand for micromobility. So there is an opportunity. Cities are interested, citizens are interested, reshaping streets for biosafety reasons, but also to enable a dynamic, agile mobility system, breaking down the public versus private, making sure that we have a seamless experience and integration between modes. And the shared electric and autonomous piece of it, if we can sync these three technologies, then we would be able to reduce carbon emissions by 80% over this decade, which is really what we need. We need 95%. Maybe we can get that. So we can get that. We can reduce cost of mobility by 40% for everyone. And we can wake up in cleaner cities, cities that are human-centered, not car-centric. But to the points you've made, Puerto Rico has seen increase already to the car demand that it had before. We see the same even happening in Oslo. How are we now making sure that we recover right? I'll pause here, Paul.
Great, thank you. Great perspective about where we are and where we can think about going. Very helpful. I want to revisit well, first of all, I want to come back to Ying, Loong, and Sathish. So in terms of the part of what you oversaw, we talked a lot about the transit and the ground, but airports. So as we get back to traveling, Ying, Loong, what are some of the I'm going to ask it this way: what are some of the mistakes that you have seen either in your own areas or in other areas, or what can we learn in terms of what are the 2 or 3 most critical things to think about as we open up airports, or they are open, but as there's more traffic in the airports?
Thanks, Paul. I think building confidence is really, really key. I think the panels have touched on that point a few times, and we have very different touch points with the commuters, and we have I love what Maya was saying. We are living in a totally different world, and in fact, the world that we're living in now, because of COVID-19, has forced us to think about using technologies in many different ways, and we can now use technologies a lot better and more efficiently, plan our routes so we can use them without too much wastage, carpool, and also develop walking, cycling as alternatives. So back to your earlier question around how do we then learn what mistakes did we make and how did we learn. I think, like I was saying earlier, there were a lot of confusion of what was good and what was not good practices, what was practicable and what was not. When one country broadcast they learned something and they're practicing something and work in their country, it was not applicable in Sydney, for example, and we have to then adjust. I think what we need to learn from that, therefore, is to be clear of what is practicable and relevant to our society, the geographic uniqueness that we have to deal with, how our transport network is actually designed, and making sure that we put in the right measures to ensure a seamless flow and to try to even out the load. Because the problem is, like it or not, all the schools start at almost the same time, work start at the same time, and retail shops open at the same time, and so on and so forth. It creates this huge load on the transport networks. And as you open up interstate borders and inter-country borders, again, you will have all this pent-up demand for the airports to deal with, and you'll be unbalanced again. We need to plan ahead and decide how we want to measure the ramp-up activity. In Sydney, we are slowly opening up the transportation network domestically, at least, and we've spent a lot of time and effort to look at the different ramp-up scenarios and what are the measures we can put in as a minimal requirement to ensure we mitigate the risk of the spread of infection. That is very important because then we can communicate that clearly to the commuters and build that confidence. And we put out clear flyers, communications, pamphlets, boards, and more importantly, people on the ground, trained and able to speak the correct language and give the assurance on a day-to-day basis as commuters come and use. Just share one little anecdote about what Sydney has done to create confidence. We have this very public slogan called "Leave No Kids Behind," and that was to encourage school children to jump on buses and trains to go to school, and so as not to clog the road network. And what the government has promised is that all the bus drivers and train operators have been informed and educated that should a kid be left on the bus stop or train rail platform, and the carriage has met capacity because of the social distancing requirement, we will still let the child go up, so that we do not leave the child behind and the child will not be late for school. The child may not be able to speak out of fear and out of uncertainty, and the government has put a lot of communication out to give the parents the assurance. Trust us, we will take care of the kids, and you can use the public transport network. I feel that is one very good way of using that confidence. Back to you, Paul.
Yeah, no, and I want to platform off of that because that is right into the two themes you've hit are technology and safety and trust. And so leave no child behind is really just, which is critical, and I get that, is part of the idea that there's confidence in the system. And I think that's the theme we're hearing, building confidence. So Sathish, just very quickly, one or two because we have 15 minutes left. So a couple of quick lessons you've learned. I mean, the populations you're dealing with are huge compared to some of the ones we are. A couple of lessons we learned and what has brought confidence and safety or in this transit system. And then we'll go around the horn here.
Yeah, Paul, I completely echo what Ying had mentioned about the preparedness and especially from the public safety point of view. But when it comes to safety, the only social distancing, hygiene and using of safety gears will mitigate the spread of infection. But the challenge is capacity reducing for spacing and meeting social distancing norm in transportation will pay heavily on the revenues and overheads. Will go up for all the transport operators, particularly in the countries like India, where the large number of people is dependent purely on the public transportation. So hence it's very important to phased manner of unlocking transportation with regulated occupancy shall be the norm to follow to mitigation risk. But further, I recently came across Asia Pacific Urban Rail Platform, brought together the entire rail operators from the Asia Pacific region to share their response to COVID-19. So the intervention response from those members and what is being observed in major cities around the world has primarily been on 5 folds, that is disinfection and sanitization, workforce monitoring, access control, and more importantly, business continuity plans and communication, internal and external. So if you ask me, as much as possible, it's always advisable to use own transport to avoid any risk of exposure in the community spread. And from the operator point of view, they should lay down a stringent SOPs with respect to social distancing, sanitization, and education in various forms for the commuters is very important. It is time to give importance to life more than the economy, and accordingly, the measures can take place while opening the transportation system. So this is what I could see. Safety plays a very important role, and preparedness is very much important at this stage.
So Katie, let me come back to you and get your thoughts on that. I think you touched on this initially in your comments, and then Jim, I want to hear from you as someone who has operated both public and private transit systems. Do you want to amplify or add to what Sathish has mentioned, or in terms of what we should carry forward in our region as we open up the T in our transit system?
Well, I think that Sathish and Ying touched upon the issues about communication, developing the confidence, and oftentimes perception is reality. So being able to see as a writer, people, as I mentioned earlier, cleaning the system, seeing posters, seeing measures being put into place. So as a writer, I feel it's safe for me to put myself in this situation. I think the other thing that Satish's comments brought to mind was we're going to need government commitment to the public transit system in even more so than we ever had before. I mean, as we all know, the fare box does not cover the cost of running the system. It's a mere fraction of the cost. But the fact of the matter is, if we need to socially distance the riders on the system, that means less revenue coming in from the fare box. And that means we need to have government support to be able to make sure that we can run the system safely with people spaced out. And I think Jim's point about making sure that we have multimodal options, whether it be Uber and Lyft, and to Maya's point about bicycles, scooters, things like that, as multimodal options for riders, going to be key in order to make moving around the cities across the world efficiently, but also to Maya's point about continuing our commitment to sustainability.
Yeah, and so Jim, as an operator of both public and private systems, let me hear your reactions to some of this and some of your other additional thoughts.
Yeah, no, I agree with many of the comments. Again, we're working with a lot of the national associations to basically develop the protocols and get some uniformity in terms of the implementation of PPEs, social distancing. The irony is that even though the ridership may be down substantially, there's going to be a need to add services in order to maintain all the appropriate social distancing. I mean, in cities like New York, for example, again, good example, they've been able to access low interest loans from the Federal Reserve Bank very aggressively, the Port Authority and the Transit Authority. Boston should be doing the same. We need to really think of, and through the plan, as Sathish suggests, a plan for the reopening. And again, I think our governor, the Governor Baker, Governor Cuomo have been very aggressive, and they need to continue to be aggressive about insisting on discipline and compliance with the rules and regulations.
So, and Maya, do you want to add to that? I mean, you sort of launched this with your initial comments, but let me come back to you.
Yeah, I love hearing that. Of course, a lot of that is music to my ears. I do want to make 2 points. One that is, I would recommend us breaking that barrier that we have in our minds between public and private mobility systems. Just because governments are pouring so much money to enable the movement of passenger cars that we are not seeing. These are externalities of the monies that we pay. You can say, these are tax monies, right? And the same goes for the public system. So I feel that if we were to adopt one main learning from COVID-19 is that concept of multimodality means that transit can be more on demand where it can, where it's not fixed, when it's not rail. and that there should be, if we adopt the transportation demand approach rather than a supply engineering supply solutions, then we would be able to do so much more with what we already have if we just utilize it right. It does not make sense that a lot of the safer mobility options, the ones that are private rides or private cars, are accessible to those that can afford them more. And so it's according to what you can pay rather than where the services are needed. If we were just providing preferential access to high occupancy, and I should probably say the right level of occupancy per mode to certain locations, to city centers in and out, where people need to go, really need to go, then we would be so much better off if we just adopt this holistic approach. And I want to also note, my second point is on KPIs. So we're talking a lot about biosafety, about what constitutes a better mobility system, a more resilient and more sustainable and more inclusive or equitable mobility system. And I think that the pathway there is already emerging in big cities all around the world. So the notion of a zero emission area, the notion of, they're slowly but surely from a street to a few streets to a bundle, a zone, a district, the city can take this gradual approach and play a huge role. And we already know that 35 cities are committed as part of the C40 Green and Healthy Street commitment. And we know that 8 cities are piloting as part of the European Commission Reval program. And we see more and more cities that perhaps are more privileged, but I think this does not need to be, if we just say, well, the city we want is that city, then we eliminate access from those that currently have the right, but they're taking rights of others. And when we think about how 90% of the space in our street can be freed to communities to thrive, if we were just to eliminate parking, on-street parking, and the demand for these types of modes that are not equitable, then we have a big portion, a big bulk of the solution already there. It's just an integration of space versus cost, and the regulator needs to disseminate that information even further, to Katie's point on the importance of information as a policy tool. I completely agree with that.
So Katie, I saw you nodding your head. I just want to come back to you to see if you want to amplify on that.
Well, I think that I think we have a huge opportunity ahead of us to really take this moment in time as people start to think about coming back to work, as it's hopefully a slow progression, as opposed to a quick, flip the switch. And I think we have an opportunity, to Maya's point, of having some total rethink about the way in which we move people around in dense locations. Again, really linking together this multimodal approach. I mean, I know here in Cambridge and in the greater Boston area, you see a lot more people on bikes, a lot more people on scooters, and this is before the COVID, and I see it continuing. People that otherwise felt uncomfortable biking around town now feel more comfortable because there's less cars. Well, that tells us something. People will take bicycles if there's not, and ride bicycles to work if they're not afraid of, cars being too close to them. So I think we have a great opportunity, and I think I do know that the policymakers here in Boston and the greater Boston area are taking advantage of it, and I hope we all do.
Yeah, and keeping it local too. I know you've talked to folks locally. What are you hearing in terms of policy, and are you hearing the same thing in terms of trying to open up those opportunities more, both here and other states in which you've been focused on?
Yeah, definitely. And I think the use of technology, again, a lot of the systems, urban systems, been very good in terms of communicating to passengers where there's opportunities for rides, where there's a lot of schedule impacts. Certainly a lot of the emergency systems that developed over the last few years, those need to be maximized going forward. And again, the idea of just having fixed route systems and assuming that people will find their way to them is not the way to go. And again, the multimodality is something, again, we're seeing a lot of, in places like Denver, places frankly like Phoenix, which was so auto-centric for years, is now developing its 3rd and 4th light rail system. because they finally have recognized the importance of that transportation access. But again, I think the new technology, the use of the communication in providing people with the options is what's so critical.
So what I take away from this is really a helpful conversation. A couple of things. First of all is I think the issues that deal and relate to transportation are no different than every other aspect of COVID-19. And there are common themes. One is safety first, which Sathish and you and others have said, safety above all else. And then communication, and Kate, as you mentioned, being visible about that. So people don't, the perception is the reality of it. I think the third is the technology and also understanding and Ying, as you mentioned, bringing everyone in. So like the No Child Left Behind is symbolic of caring for everyone, but the community as a whole participating in it. It can't be government down, it can't be people up. I think it has to be both, and that's what I heard there. And Jim, with what you're doing in terms of the overlay of public and private and technology and safety and advancing the ball. And lastly, Maya, just the idea of equity and diversifying our modalities and being more strategic about what we use and when. And so I think those are great takeaways from all of this. I just want to thank you all. Sathish, we have one final comment. Okay.
Yeah, one final comment, Paul. While we have spoken, I'm not sure about the other countries, but as far as India, these liability issues have become very important. Like public transport, all that is fine. Apart from ensuring the stringent protocols, education, and enforcement, today, if you some of the transport operators in India and governments have gone for a special insurance coverage to mitigate the risk liabilities of COVID-19. So that's another big learning and takeaways for the countries who's not following, because that's something that India, whether it's private, public, I think this is making a big difference when it comes to liability issues of employees and passengers.
Yeah, that's a great
Sorry,
point.
I just thought it's very important.
You know what? I'm so glad you raised that. It's an important point. It's a good place though to end. And I want to wish you, Sathish and Ying, a good evening. Maya, a very early good morning. And Jim and Katie, have a great day. Thank you all for participating.
Thanks, Paul.
Have a great day.
Thank you.
Thank you all for joining us.
Thank you, Paul.
Thank you. Pleasure
everyone.
talking to all of you.
Bye-bye.
You guys.
Thank you.
Bye.